Good day, everyone. My name is Rametse. I'm a medical doctor and an immunologist, basic science immunologist. And today I'm draped in Pose Couture. And we are actually having this session at Pose Couture, owned by my beloved Yvette, who I'll introduce properly just in a few minutes. So yeah, I decided to shoot this video to give people an update, just an update on key developments in HIV, in the HIV space, both in terms of research and the clinical side. And I think this is very important because I've kind of invited Yvette, who's an activist, so that I give the perspective from a clinician and a lab scientist side of things. And I want her to then side by side give us an update in terms of how that looks on the ground. And so Yvette, do you mind introducing yourself?
Hi, thank you so much, Lerato, and thanks for coming to Posi. It's so humbling. My name is Yvette Raphael, and I'm the owner of Posi, and I'm also an activist and advocate, a fierce fighter for human rights. And yeah, I think in the next few days, my HIV virus turns 27. Yeah, sure. Thanks.
Wow.
Coming.
So a living example of someone who's thriving, living with HIV, thriving on treatment, doing very well, and also doing some activism work, advocacy work for other people living with HIV. Particularly her interest is with women living with HIV. Happy World AIDS Day. And I think the first thing that I would like us to speak about is, why is it still relevant? You know, you meet people at meetings saying, why are people still talking about HIV? So firstly, in the latest reports, South Africa has around 12.8% of the population living with HIV, making it up around 8 million people living with HIV. That's not the problem though, because we're having a higher number of prevalence or people living with HIV in our country because a lot of people are already on treatment. So that's kind of a good sign. The concern, however, is the number of new HIV infections in the country. In the latest reports of 2024, in just a year, we had just over 170,000 new infections. And that's where the concern is, that despite having good treatment and people doing well and living longer, we have way high new rates of HIV infections. Secondly, as a clinician, we still treat a lot of people with TB. And according to the reports, our national reports, 54% of TB diagnoses are within people who are living with HIV. Mm-hmm. So that's still a huge burden in terms of the comorbidities. Another reason is that even in the clinic, it's been very devastating to see young women with cervical cancer. And according to reports, people living with HIV are 3 times more likely to live with cervical cancer. So, I mean, I could go on and on, but another very important reason is that even though our program is doing very well, shout out to our National Department of Health, in terms of picking up HIV and treating, we've reached the 95% target goal for diagnosing pregnant women with HIV. However, we're still at 73% for diagnosing newborn babies with HIV. And also, we still diagnose newborn babies and infants with HIV, and that's very sad. According to the latest report, just over 6,000 new infections were detected in newborns. So really, there's still a lot that we need to address in the HIV space. Finally, I think we all know, I hope that we all know as South Africans, that we are the leading country in terms of HIV infections globally. So we cannot lose our eye on the HIV space. We cannot stop doing the work. The work needs to continue. And we still need to reach the 95 goal, which is we're supposed to pick up 95% of people living with HIV should be tested and picked up. 95% of people living with HIV should be on treatment, and 95% of people should be suppressed virally on treatment. So, Raphael, in your perspective, why is World AIDS Day still important?
I'm still here. That is why. I mean, HIV and World AIDS Day, it's recognizing our history, recognizing our resilience, but also remembering that we are here because there are people living with HIV. Even if there are no new infections, there will always be people living with HIV. And for that is a very personal time. When I spoke earlier, I spoke about my own diagnosis. I was diagnosed at a World AIDS Day event. And that's why I say it is still relevant. So we still commemorate World AIDS Day, we still need to go out to communities. We still need to go out, the testing that you're talking about, we still need to go out to our, our people out there to educate them about HIV, but also so that they can get tested. And the beautiful thing is right now, if you test positive for HIV, you immediately go for treatment and you can live long. And that was not the case before. And why we still have to remember commemorate World AIDS Day, because our past, you cannot erase a whole human existence. People living with HIV didn't decide and say, woke up one day and say, we want to be here. A pandemic happened and we were infected with HIV. However, we need to be recognizing where we come from so that we know where we are going, prevent new infections like you're speaking about, on the ground. So the reality about getting a test for HIV is still there. I speak to a lot of young people who are born with HIV. One of my pet hates is that we still have children born with HIV.
No, trust me, even in the hospitals, we find it devastating.
Yes, because there is treatment, there is mother-to-child transmission, there is prevention. There's everything that we need to ensure babies are not born with HIV. So when I go in the communities and I find a 12-year-old struggling with telling their HIV status or accepting what they're taking. I spoke to a young man the other day and he said to me, Mama, but why are my friends not taking this medication? Why is it only me? And explaining to this child that he has HIV, it's going to be very difficult. And it's proven very difficult because in his head, why is it me? Exactly. Why am I born with this disease? Exactly. So we still have a lot of work to do. HIV prevention with young people, the new numbers with young women and girls, it is also still so devastating because we have PrEP, we have HIV prevention.
And we'll get to that extent.
We have methods that are there, but these young girls continuously get infected because I don't think we are ready to face the reality that older men are the problem here, not the young girls.
You're already starting with your controversy, but we will get to that conversation. But you mentioned something very important before we go on to the next section, acceptance. I actually think it's actually a huge problem. I think it's something we don't speak about a lot. And I also see it within the clinical space where, in fact, there are people that get diagnosed and then they leave and they don't come back because they're just like, no, I don't know. The acceptance part is actually what, changes everything, because once a person accepts that they have HIV, they gladly take the treatment and they take it well. And then they're virally suppressed and they live well. So acceptance is also something that we're still tackling as a field. But also I think World AIDS Day is a good moment to remind people that, and I hope this video will show you the progress that has been made, in the space, and that really the quality of life has improved drastically. And also the mortality rates, the death rates associated with HIV are really have significantly dropped. I'm not even going to give you the numbers because it's really a significant drop. But yeah, just moving on to the next, kind of the next topic, or another aspect of this is to talk about treatment. So what I'm going to do in this video is that we will speak about key developments within treatment, key developments within HIV cure, and key developments within HIV prevention. So in my opinion, when it comes to treatment, firstly, in terms of accessibility, we have done really well as a country. 8 in 10 people in South Africa are on antiretrovirals. So again, shout out to the National Department of Health for such good work when it comes to that.
I think you knew that, because the Minister of Health, why do I feel like you're trying to give them brownie points? Are they really doing this good, Lorato?
Honestly, Yvette, I promise I'm not even trying to get brownie points, but I do think sometimes, and it's a really strong personal opinion when it comes to the National Department of Health. In as much as there are a lot of failures, but there are also a lot of wins. I do feel that the National Department of Health, in terms of the program for HIV, have done really well. And so this accessibility, in as much as there are also other organizations, NGOs such as yourselves, that have contributed to people getting onto treatment, we should give credit where it's due in terms of the National Department of Health.
I totally agree, because that was a dig. Just the fact that we survived the past 8 months and we did not go through so much of the devastation that we thought we would. I also want to give up props to the Department of Health for standing up for us. South Africa is one of the countries where our health care is almost 75% dependent on our government. And for me, that is amazing. I think the South African government has the most difficult jobs, because for people like me, we're holding them accountable. We know why we voted for. And it's important that we always call them out. But where things are done, like the past 8 months, I fought with the government all the time, but I felt so good being a South African, looking at other African countries and their states, but also globally. I know the United States is also struggling with treating their people living with HIV.
Wow. Yeah. And so, the other thing, again, in terms of just updating everyone, because you and I know very well, the accessibility, as we've highlighted, but also the number of pills that people have to take. We moved from multiple pills to a single pill. That also helps with adherence. We've also, yes, clock it. That's the Gen Z.
We're trying to fit in.
People no longer have to take multiple pills. Majority of people can just take a single pill once a day. And so that also adds to the adherence. The other thing is the side effect profile. I mean, Yvette, you would know, even from a personal experience, and I would speak from just the clinics and what I know clinically, that, there was a huge, side effect profile that was even creating stigma, adding to the stigma in the past.
Just when I was diagnosed with HIV and having to start treatment during that horrible era of denialism. And now I don't like the denialism. I don't like what is happening, but I'm hallucinating. I remember dreaming Thabo Mbeki kidnapped me. Guys, those were the realities. And trying to figure out, when do I take this treatment? And it was not the choice like now. It's one pill. I take it at night. I take it in... you have to take twice. You had to take whatever you're taking twice a day at the same time. And I tell you, the stigma was so rife, your family would start noticing, why is this one always going to the sink generations? So even if you did not want to disclose how you took your treatment, disclose your HIV for you. And people used to struggle so much, including hiding their treatment. And we are now in one pill a day. I'm also on DTG. It is the easiest thing for me. It's the easiest thing for me. I am able to just take my meds and I carry on with my life.
I love it. On the topic of DTG, which is dolutegravir, it's the kind of a recent power drug. Honestly, I call it a power drug for HIV. It's really been revolutionary, in my opinion, as a clinician and also as a scientist. Dolutegravir is special in that, firstly, it's very fast in how it suppresses viral load. It's kind of compared to other drugs, because there's a whole conversation about drug resistance with antiretrovirals, but dolutegravir has low resistant profile. And so it's been really a wonder drug and is one of the key developments within the HIV treatment space. Dolutegravir is a really good drug. However, there's been recent, conversations, because people are picking up mild resistance with dolutegravir. It's nothing to be alarmed about, but I think in terms of just keeping people updated, that just as a field, researchers also need to spend a lot of time trying to get on top of it before it actually becomes a problem.
Yes.
But yeah, that's kind of, where we at in terms of, treatment. So more people can access treatment, less tablets, side effect profiles completely diminished. Dolutegravir is also popular for, having low side effect profile.
Yeah, but also don't forget that this government that I bash all the time has made it possible for people to get CCMD. Go to the clinic, pick up your 6 months pills, taking away the clinic time. As somebody who works, I can just imagine having to go to the clinic every month to go and pick up my drugs. Somebody picking up their drugs for 6 months and their life is almost back to normal. almost back to
Almost.
usual. I don't want to say normal.
Also on that topic, there also the recent law, remember that was, successfully passed to say pharmacists can now actually prescribe antiretrovirals. I think that's very progressive.
Yeah.
And it's actually a very key development as well within the treatment space, that now people don't have to depend on a clinician to prescribe.
Yeah, and how I hated the Neem art story.
Oh, are we going to go into it?
No, we don't have to. If you want peace on this lovely interview.
Let's balance the peace and the truth.
Yes. Yes.
Yeah. So HIV prevention. So because now we have treatment, and there's a lot of people that, are living longer on treatment, reduced, mortality rates, the death rates. A lot of the science field is actually focused on HIV prevention and HIV cure. And now we'll talk about, the key developments within HIV prevention. And I want to start by saying condom is still the most efficient way of preventing HIV infection. It's been shown, I know you're rolling your eyes, Ms. Woman Activist, but it's been shown to reduce HIV infection by over 90%. And I say this because my PhD work actually looked a lot on asymptomatic STIs, just as a thing on the side, that there are other STIs obviously outside HIV, and studies have shown that, those STIs actually increase one's chance of getting HIV. And also majority of them are actually asymptomatic. So you could be having chlamydia, you could be having gonorrhea with no symptoms. And we know at the moment our guidelines don't cover for, asymptomatic management. We use what we call a syndromic management at the moment, where you only treat people who show symptoms. So there's a significant number of people that have, asymptomatic STIs, just as a side note. And I say that because a condom is also good in, not just you have burning things to say, but you have a chance to say it because you're allowed.
Yes.
So it's still, so people must not forget that. And I think the key development thing that I wanted to highlight with prevention, and what I love about how we've grown in the prevention aspect, is the concept of options. I think that's where, as a field, we are kind of focusing on that. Let's not prescribe a specific, prevention tool. Let's have all these options and let people choose what works for them. And I think that's the key stride and the key. Oh, you're smiling now.
Yes.
I was getting there. I still support that as well. Condom is just one of the options as well. But yes, no, I fully support that. I think one of the developments that we've made in the prevention space is the concept of options. And so when you think about HIV prevention, we stratify them into prophylaxis, which I'll go into, and also vaccination. So prophylaxis is more of taking a medication for a temporary prevention at that time point where you are exposed to the event, or have been exposed to the event, or about to be exposed to a risk. And vaccines are more of getting a treatment that would induce, a durable protection. And that's where there's a lot of gap. And I'll just give you a few highlights on that. But when it comes to prophylaxis, I hope that we all know that we have pre-exposure prophylaxis and post-exposure prophylaxis. So you can take, and what is very important about this PrEP and post-exposure prophylaxis is that, science has evolved so much in terms of, this HIV space, such that we can actually use the same antiretroviral drugs that we use for treatment for prevention.
Yeah.
And I think it's so important for people to note this, because there is this thing where people think if they see someone using, antiretrovirals, they are living with HIV. Antiretrovirals can be used for prevention.
Yeah. And that is exactly where we are. And I am so happy that you spoke about choice. You saw my first face light up, because for me, is that choice that not just the young woman makes, but that choice of what methods am I going to get that I can choose that suits me at my point of need, because we all have different needs. I frown on the condom because I know young people don't have that much power to negotiate for the use of a condom. Imagine you have this big old man and trying to give him a condom.
But also heterosexual men, you guys really, really, really
need to stop.
You need to stop, because And I'm sorry to interject because
It's okay.
Honestly, it's something that I really, it's a personal burn for me, especially within the HIV field, that yes, large majority of the documented HIV infections are in young women. But where are they getting the infection from?
Yes, they're getting it from older men. They're getting it from mobile men with money. They're getting it from their uncles. And that is the unfair part. And it's also 16 days of activism. So all of these things culminate at this time. But back to HIV prevention and choice, I am happy that we have an opportunity to get South Africans to go to a clinic and choose between, I call it, rings, jabs, and pills. Because people can choose whether I want a ring, I want a jab, or I want a pill. And that is important because we are not homogeneous. Women go through different stages in their life. Young people would love to keep their HIV prevention secret, and they might choose something different. So I'm just happy that we have those choices. And I'm also glad that we having this conversation for us to inform people of what is happening. Conversations like this never used to happen a lot, but then everybody started just making HIV look cool, and we almost dropped the ball. So thanks for bringing it back and saying, how do we educate people old style, but also using new technology?
Yes.
As you can see, I am here.
No, absolutely. And honestly, I do also want to urge women, I think just from a clinician perspective, I've had so many moments within the clinic where you diagnose women who are within secure relationships. And so I think we really need to stop this thing of, oh, I'm in a committed relationship, oh, I'm married, therefore I don't need to use HIV prevention. And you know your reality as a woman. I just really hope from this video that you'd remember that you have the rings, the jabs, you have options, and you can choose to, put the honors on yourself to say, I think, where I'm at, it would, benefit me to take something to prevent myself from getting HIV. I hate to say it now, but the sixth sense is also a thing, right?
Yeah.
So, and I know you can never, guarantee in some circumstances, especially in our country where, we have such high rates of HIV. So the chances are high to get HIV, even when you are within a secure relationship. And I think it's a reality call that I want a lot of women to get to grips with.
Yes, but you can also only be responsible for yourself. I can't be responsible for somebody who is going to work and not being at work, who has left the house, gone to the movies, gone out with the boys. I think when it comes to HIV prevention, it should be a personal choice. And if you think your partner is cheating, he is cheating.
The sixth sense.
It's that sixth sense that we are talking about. And way before, this was the kind of discussions that we used to have. So I just think people need to also, us in this space, when we talk about HIV prevention, it's almost like we're doing it for other people. And I always say to people that all of us are customers for HIV prevention. Even if you are Aaron Matsualedi, you are a customer. If you are negative, you should think about being on an HIV prevention method. So the customers for HIV prevention are negative. It's not positive people.
I love that.
And we should not exclude ourselves.
I love that.
Yeah.
Sure. Very well said. I can't add anything to that. And I think just to summarize on the prevention side, we've spoken about pre-exposure prophylaxis, which is antiretroviral drugs a combination of antiretroviral drugs that you can take when you're about to encounter what you deem to be a risk, right? So if you feel that, I'm not sure, I don't know this person's status, and I'm about to engage anyway, take pre-exposure prophylaxis. Side effect profile is also good. Post-exposure prophylaxis, if by accident you are exposed, I mean, for us clinicians, if you have a needle stick injury, if you have a splash of someone who has HIV, but in the practical sense of normal day-to-day living, if you kind of find yourself in a situation where you've been exposed and you engage sexually with someone who didn't disclose, and then you find out that they are, well, I don't even know if you'll find out immediately. But if you're concerned that I've exposed myself to someone who I don't know their status, within a certain window, you can also take what we call a post-exposure.
Yeah, but it's also just, it's a whole thing. It's not something like you'll just be given HIV treatment or ARVs to prevent for nothing. You'll get your tests, they'll ask you about pregnancy. And then if you are HIV negative or positive, there's things that would follow. So if you're HIV negative, they'll give you the PEP. But we have also advanced into thinking around PEP in pocket. Guys, we should demedicalize this thing. HIV prevention should be something that you do for yourself, and you do it so lovingly because it is self-care. It is really not something
guys,
that you need to ask a doctor.
Self-care also includes prophylaxis
and getting tested for your STIs and getting tested for all kinds of things. I did self-care the other day and I went for a diabetes test. And
you know what? Actually, it's a point. We'll talk about that because that's also the key thing. That's a development within the HIV field. That now that we have people on treatment and people are living longer, the new challenges within the HIV space and people living with HIV are chronic diseases.
Yes.
So now, non-communicable diseases, and therefore now there's a lot more focus on screening for non-communicable diseases and people living with HIV, because now the comorbidities that people are struggling with in this community, it's diabetes, hypertension, cardiac issues, and it's also because there's this chronic immune system activation. Your immune system is still active even though you're suppressed.
And 27 years, like myself, I started my ARVs when I had to start it. But also just to think that never did I think that I would be affected by any other thing. The other week I came from traveling for 2 weeks in a row, cold Europe, and came back. All I wanted was home food. I made pap on Saturday.
And she loves her pap.
And I made samp on Sunday. Midnight. Did I not struggle to breathe? The food that I love is now trying to kill me. That is the NCDs. That is the reality. If I want to, actually, I made a conscious decision that the pain that I used to feel, I'm going to treat it by not taking Coke. I take Coke Zero these days because it is important to take care of our bodies. I don't want to be a cranky old person. I just want to look after myself, and I'm going to start going to the gym. Behind my house, there's a gym. I have to go to the gym. I better
see you post about it on your WhatsApp. I need the evidence.
Yes, but it's important that we look after ourselves, because I tell you, the diseases that comes with living long with HIV and taking treatment, it's a reality.
It's a reality.
And the intersectionality, we need to start talking about it.
Absolutely.
I didn't like Dr. Manto, but she used to tell us, you're like, just going to be all big. Now, look where we are. We need to really look after ourselves.
Absolutely. Honestly, key takeaway message as well is that non-communicable diseases are also, a reality now that there are more people living longer,
including cervical cancer screening. Can you please explain to us that one before we forget?
Yeah. So as I mentioned when in the introduction as to why it's important for us to have these conversations, cervical cancer, people living with HIV are 3 times more likely to have cervical cancer as opposed to people living without HIV. So screening, we really firstly, let's talk about the HPV vaccine. So the HPV vaccines is recommended for the young girlies in primary school. So if your children, preferably people who have not been exposed at all. So your young girls, moms, please, the programs actually go to schools in public. I know that. So get your children vaccinated with HPV from that age. But in terms of adults and young women, we recommend that, the recommendation is different based in public and private. In the public sector, the guideline is that in people who are not living with HIV, it's recommended that you do an annual pap smear from the age of 30 onwards. So the moment you turn 30, every year you're supposed to do an HPV, which is it's a virus that's been known. HPV is a virus group, and there are different kind of genotypes, and some actually cause cervical cancer. But you do the pap smear, which screens your cervical lining to see if you are showing changes leading up to cancer. So the screening is very important because you can pick up the changes before you lead to cancer. And there are actually interventions we can do surgically to remove that part of the, of your cervix that's already changing before you progress into cervical cancer. It's also dangerous because you don't have symptoms often for cervical cancer. Hey, the moment you start having symptoms for cervical cancer, you are in stage 4, stage 3. So that's why screening is pivotal. In people living with HIV, it's been recommended that you screen from the age of 25 onwards. So younger and annually for both.
Yeah, and also just to mention that sometimes the surgical things that you're talking about, it means removing the uterus, guys, and nothing's going to happen if you don't have it.
Not at the beginning, not at the beginning.
So we should though. Nothing's going to happen if I don't have a uterus. Will I still be able to enjoy sex?
You will.
Okay, so that's unfair.
But I don't want you guys to get confused. The reason why pap smear is important is that we can catch the changes while they're still local.
Okay.
Before they even get to the uterus. The uterus meaning the womb. So if we catch the changes locally, we can just remove that part and you're still fine, you're still intact, you can still have sex and everything. Often when we get to the drastic interventions where we remove the uterus, it's often when it's like almost, really end stage. So pap smear is also important for that. You're just having a minor, intervention where they remove it.
Okay.
Yeah. So
see, it's nice to know doctors.
So yeah, the other aspect of HIV prevention is HIV vaccines. It's also a huge field in basic science research. Don't giggle because I'm going to be very neutral about this. But HIV vaccine is something that people are really exploring. And I'm not going to go into the details, but the key challenge, to be honest, with HIV vaccines is getting the right immunogen, getting the right kind of the right product to put into whatever you're vaccinating, such that it mimics the HIV infection in a way that you can get a good response, right? And so the issue has been getting the right immunogen. And there's also the conversation of broadly neutralizing antibodies. I don't want to, get into the details.
BNABs is my favorite word.
Really?
Yes, that.
Yeah, but we're still trying to get the right immunogen to induce the responses we want to see, including responses like getting, broadly neutralizing antibody, which is a large focus in the lab that I'm currently based at. And so,
but before you go, so people who say Len is a vaccine, Len is not a vaccine. It's still HIV prevention, right?
Whoa. How can we not talk about Len? Do you want to tell them the full name?
Lenacapavir?
Yes, lenacapavir.
Yes, it's the twice yearly injectable HIV prevention method. But before we go there, we also have a quarterly injectable, which is cabotegravir, which is luckily it's also kind of available in South Africa at some research sites where people are, doing this OLA studies, out of label studies. So it is available in some of our clinics. Lenacapavir is coming next year. It's approved in South Africa. It's on the medicines essential list.
And shout out to our National Department of Health again, because are they not committed to also?
They are moving fast, but we must want more things. They must make sure Len is available. They must make sure cabotegravir is available. They must make sure the rings are available. But Len, the exciting part is lenacapavir next year will be hitting the South African public sector, and we want people to go and get themselves injected with this HIV drug that prevents you from getting HIV, and you only go twice a year. Guys, the science is evolving. Don't let the science leave you behind.
Oh, I love it. And yeah, like she explained, instead of the oral technicalities of, when should I take it? With the injectables, it's twice a year or quarterly, and you are certain that you reduce your risk of getting HIV infection.
And also, these medications are longer acting now. So people can keep things in longer and you don't have to. And there's also 1 monthly HIV prevention coming. There's both an HIV prevention and a contraceptive in one man dog.
As you're saying this, of course, and that's the question, and I know the answer, but I think you need to also inform our viewers. People are probably thinking, what are the side effects profiles looking like?
Yes, side effects like any other drug, there are side effects, but there's adverse side effects that we need to look out for, right? But if something is not for you, don't do it. If you get to the clinic and you get severe headaches, stop whatever you're taking. And in the future as well, we don't know how these drugs are going to react. It's the people that are going to tell us. But importantly, Doc, is that we want to prevent new infections, especially with young girls. But we also, the exciting part is that in previous HIV preventions, we did not have, women and babies and lactating people start the treatments the same times as us. Now, pregnant and breastfeeding women are allowed to immediately be part of the Lenacapavir agenda. And that is amazing. They don't have to wait. The only thing that is a indication for Len is really just weight.
Sure.
So 13 and upwards can get Len. So yeah, we're getting there.
Oh, really, really encouraging, right? There's really been a lot of progress, and I really hope that you're appreciating through this video, you're really able to appreciate, how, a lot of the research and the work that's been done is all translating into impactful changes, and make use of all these tools for HIV prevention.
So yeah, 27 years living with HIV. For me, the big prize, the trophy, is still a cure. Doc, tell us, you guys are in the making. Dr. Tumbi is busy cooking in KZN, is cooking in KZN. Others are cooking stem cells in the US. Some of our friends are still dying. When are we getting a cure? But how far is the science?
Oh, I must be honest, just like with HIV vaccine work, I personally feel that it's slow, but there's progress, right? And just to explain to everyone, when someone is infected with HIV, remember HIV integrates itself into your, genetics of specific cells. So when you're on treatment, there are certain cells that have been infected and they switch off and they're silent. So that's what we call the latent reservoir, where they're not flagging that they're infected, they're just silent and literally waiting. And that's why we have what we call rebounds. If you stop your antiretrovirals, then you get infection again. It's because those silently infected cells, they start being active again because, there's no, suppression. But also, antiretroviral treatment cannot get to those cells. And so one of the key focuses of cure is to try and reverse the latency. But remember, these cells are, cells that HIV prefers, and these cells can be in different organs. It can be in your circulation, it can be in your lymph nodes, it can be in your gut. So firstly, there's one of the key focuses of cure is the latency reversal thing, and they call it the kick and kill method, where they use reversal drugs to target latently infected cells to kind of wake them up to say, please express. And then while they're, active again, they then target to kill those cells. Sounds great on paper, in my opinion, but, there are many challenges with that. How do you target all the cells? We don't, at the moment, we do know some of the parts where the cells are, but there's still probably other parts in the body where we don't know where they're sitting. But there's a lot of research, very dedicated scientists that are doing that work. And, Prof. Tumbi is also part of the, that group. And the other thing is, gene therapy. And so when you kind of remove certain genes that are expressed on cells, that express the proteins that are needed for HIV to attach to them, particularly, CCR5. And so that work is also, there's a lot of effort that's been put there, but the progress is, slow and steady. What do they say about slow and steady? No. Eventually wins. So we still have to be hopeful that it will eventually win, but it's slow and steady. And, it's a whole conversation about, I have a lot of opinions about how I feel sometimes people speak about cure on social media especially HIV cure, I think sometimes there's a level of not being realistic. There's a level of dishonesty. And I think sometimes people, even news channels, use captions that are so, dramatic and not really.
Drive misinformation and can get people to start talking about all of this quackery that's happened. All I'm happy for is that science is going to survive. Science is going to continue finding a cure for us, because like I say, it's a big prize, whether it's therapeutic, and which is the other one for the negative people.
Sorry?
When you give somebody, a negative person, the cure, and they is it therapeutic? Therapeutic is for the positive people.
Yeah.
So for
therapeutic
us,
is
for when you treat somebody who's positive. So for us also, that is one of the things that we need to look out for, because these studies are going to happen with people living with HIV already. I
actually didn't even want to get into that, because it's a whole new conversation.
Yes.
It's actually something. Yeah, it's a whole new conversation. It's a whole new movement as well within the fields, where these now studies are going to be, or have started actually happening in people living with HIV for various reasons. I don't know. If people like this video, we could make more videos and actually explain why. But a famous trial within the African context is the Brilliant trial. They will also be using that concept of, testing different immunogens for vaccines within people living with HIV. Exciting concepts. But there's a lot more I can say about the cure stuff and the prevention stuff, but we're really trying to keep this very tight. And so Yvette, I was saying to her during one of our breaks that I think it's so beautiful to sit next to someone, or to even know someone personally, because we know each other personally, who is so optimistic with life, who is genuinely happy, who is doing well physically, who's doing well emotionally, who's doing well career-wise. You're an award-winning, an internationally recognized activist, and you've recently gotten a really great award recognizing the work that you do within the space. So your life hasn't stopped, Yvette, and that's what I love. And so I want us to wrap this up with you telling us, what would you say to someone who's just been newly diagnosed with HIV?
I would say HIV wins when you are silent. HIV wins when you don't want to tell anybody. Disclosure is a different topic, another topic, but I personally chose to be happy because I had a 1-year-old baby who is now turning 26.
Wow.
A 1-year-old baby when I was diagnosed with HIV, and I chose to be happy. I chose for her childhood to be happy. She has pictures. Yesterday we were going through these pictures, and she has pictures. She says, Mama, I remember my childhood being so happy. It was tough, but it was happy because I wanted her to be happy. But for anybody getting diagnosed with HIV right now, unfortunately, it is what it is. But HIV's got nothing on you. Stigma only wins when you are scared, when you don't want to talk about it. And try disclosing, and you can see just how you take charge of your life again. And this used to be my story. This shop where we are in is called Posy. It's got nothing to do with chilling Posy. It's about positivity. When I was diagnosed HIV positive, I was like, why are they using such a positive connotation to something so negative? And I flipped the script on HIV.
Actually, funny enough, in the clinics, people used to think when you say they're negative, it means they actually have the virus.
Yes.
They also have
and I'm from that era. And I'm from that era. And I just literally flipped the script on HIV. I wake up in the morning, and when I feel depressed, I dance in front of my TikTok, because I tell myself, you have to be happy. You cannot die miserable, guys.
Actually, I think of ladies like Nosy. I forgot her surname, but how she likes putting it is living positively with HIV.
Yes.
And I love that. And she's also one of these, someone who's very active online, who speaks about her journey, very young girl. And, it's so good to see more people coming up and, sharing their journeys and just reminding people that, it is our reality. Like you said, it is what it is. If you're newly infected, but it's not the end of life, honestly.
But also, nobody gets out of here alive. Everybody's so worried about dying people. Nobody's going to live here
We are dying somehow.
We are going to die. The only issue is the mode of transport. How? Is diabetes? Is it heart attack? Is it HIV? Is it an accident? But yeah, emhlabeni sophuma sifile.
Sure. And I think, so thank you for that. And I think I just want to wrap up with, these key opinions that I have about just the HIV field and everything that we've summarized on. Just on my very personal, I'm not representing other experts in the field by my personal opinions, just with what we've spoken about. Firstly, I think in general, we definitely have to continue prioritizing the 95 goal. I think it's a very good approach in, getting on top of things. Secondly, we're doing well with treatment. We have this power drug, dolutegravir, but we also, I think I want to encourage scientists, in the field to start looking at this emerging resistance, because it's a good drug. We don't want to lose it. The resistance is starting to come up. We need to work. We need to see. We need to do some studies and try and characterize it, understand it, and see how we can get on top of it before it's a huge problem. And when it comes to HIV cure, to be honest, in my opinion, just looking at some of the existing studies, is that we need to start thinking about precision medicine and incorporating personalized approaches to cure. I'm an immunologist, and I know just how complex the immune system is. And within someone living with HIV, if I had HIV and she has HIV, the profile of our immune system is so different. So we also need to start thinking of, as we think of cure, how do we capitalize on our knowledge on immunology? How can we start profiling and, start tailoring our approaches to cure in a more, personalized way, but also start also being more open to combination therapy. So because it does look like, cure, and it's something that Prof. Tumbi also speaks about, that cure is, we might have to also think about it in a more combination approach as opposed to one cure, using different strategies to cure.
Glenn.
And finally, we should continue with this approach of giving as many tools of prevention as possible so that people can choose what works for them. And so, with that being said, Yvette, thank you so much for this wonderful conversation. I really appreciate it. And I really, really hope that people will appreciate it. I really hope that we were not too sciencey. That was the aim. Because I really hope that people will really, sit down and listen and just empower themselves. I think one of the key things I've gotten from this conversation with you is how you always speak about advocating for yourself.
Yeah.
I think that came up a lot. And I think that's so true.
If we don't open a channel, can we at least do this every year on this couch?
Every year it's too long.
No, if we don't do anything, remember you have 2-3 people there at home. They are keeping you busy. So if anything, can we do this again next year? World AIDS Day, we have the same conversation. And then we have some ideas. What happened to Len? What happened to Cab? What happened to everything else? But I think, importantly, people want to hear this kind of conversation. And yes, thank you so much for coming.
Thank you so much. And also, it depends on you guys. Let's see what the viewers, what the viewers say. If they really, really, really want us to come.
Rama first. Thank you so much, my darling. Thank you so much.